Good morning. Thank you for joining us this morning on this very important topic of burnout and the importance of leadership and inspiration. So we have a very distinguished panelist today, and I'm truly excited. Our speakers do not need much introduction. First speaker is Dr. Tamara Fountain. She's a professor at Rush University Medical Center and section chair emeritus of oculoplastics surgery and board directors of American Board of Ophthalmology. And she was the past president of the American Academy of Ophthalmology in 2021 and past president of the ACE Opters, and served 15 years with OMIC and chair of the boards, and past president of Illinois Society of Physicians and Surgeons. And our second speaker is Dr. Hans Grossniklaus. He's board certified both in ophthalmology and pathology, and he's a professor of ophthalmology and pathology and vice chair at the Department of Ophthalmology at the Emory University, director of the L.F. Montgomery Ophthalmic Pathology Laboratory, and founding director of the Ocular Oncology Service. He's a world-renowned ocular oncologist, and is the past president and current executive vice president of the American Ophthalmological Society, which is one of the oldest societies in the field of ophthalmology, and is the past president of American Association of Ocular Oncologists and Pathologists and for Zimmerman Society, and is a board director of the American Board of Ophthalmology. So our first speaker is going to be Dr. Tamara Fountain, and she will be talking on this very important topic. Thank you.
Thanks so much, Donny. What a pleasure it is for me to be on screen with my colleagues and people I admire, and really honored to be speaking to all of you today. I can't wait to learn from Dr. Saw and Dr. Grossniklaus. And I also just want to say that for all of you impacted by the earthquakes in Turkey and Syria, that our thoughts are with you. We are sending global thoughts to all who are impacted. So my topic today is burnout in ophthalmology. And I'm going to go over in the next 15 minutes or so the scope of this globally and the role of leaders in finding solutions. So we all know what burnout is. Essentially, it is a constant or prolonged stress or frustration that is born of exhaustion, either physical, emotional, or motivation. And it's interesting, in 2019, the World Health Organization added burnout to its ICD-11, so it's now a diagnosable condition. When you look at the scope and reach, this is a table from an article on burnout in Lebanese physicians. And in a review I did, I found papers on burnout in China, in Nigeria, in Brazil, in Russia, in India. So it's clearly something that we're all grappling with, no matter what corner of the world we practice. Medscape did a survey in 2019 of global physicians. Now, this is about 20,000 physicians concentrated in the European countries. And at that time, 2019, remember, this is before COVID, the vast majority of people reported no burnout whatsoever, and even fewer reported any depression. When you looked at what were the top burnout factors, you'll see here very common to the things that you all said impacted you as well. Too much paperwork, too many hours at work, a lack of respect, feeling like a cog in a system that emphasizes profits over patients. Other factors included regulations from the government, a feeling of insufficient financial compensation, increased EHR burdens, and overall a lack of control. So when they asked those physicians, well, what would help reduce the burnout? Well, it shouldn't be surprising that most of the reasons have to do with undoing some of the things that cause burnout in the first place. More support staff to help us with our tasks, more control over our schedule, over our call hours, greater respect, if that's something we could wave a wand and engender. More compensation, decreased regulations, decreased patient loads, greater flexibility, and more respect from our patients. Interestingly, from these 6 countries, when asked whether their workplace had burnout programs available, most said no or didn't know. This is interesting as well. How many of those physicians were seeking help for their burnout or depression? And of those who experienced it, very few said they were seeking help. And I think this is a very ominous sign. When you look post-COVID, as we might imagine, things are even worse. In a study done in 2022 across 10 high-income countries, they found that most physicians reported increases in their workloads. And unfortunately, our younger physicians defined in this survey, and I love this cutoff, age 55. I love to be considered young when you're under 55, but the young physicians were more likely to experience stress, and they were more likely to seek professional help than their older colleagues. And this should get everybody's attention. When physicians are under stress, they don't provide the quality of care that they would give otherwise. Half or more of older physicians reported that they would stop seeing patients within the next 3 years. And this means that we're leaving even more of a burden to our younger physicians who are already more burned out. The US population of physicians was surveyed very recently, and I'd like to just share a few of the outcomes of this survey. If asked if they were burned out or depressed, 53% said they were burned out, and 23% said that they were depressed. Importantly, in 2018, just 5 years ago, only 42% of patients said that they were burned out. So this is about a 25% increase in the number of people who are considered burned out. When you look at the population of physicians across the board, it's primarily in the US, our primary care colleagues, in particular post-COVID, our emergency medicine colleagues who are bearing the brunt of burnout. But it looks like many professions, both surgical and primary, are suffering. Ophthalmology tends to be a little bit further down on the list in the US. There is a gender gap in burnout, women reporting far more. In 2018, these figures were 38% of men and 48% of women. It is felt that women carry more of a burden at home and during their time at work, feel a little bit more stress because of a greater lack of autonomy over their work setting. The take-home message from this slide is when you look at burnout by setting, the people who experience the least burnout are those who control their destinies, are in solo private practice in an office. That's very interesting. What contributes to burnout? We should start seeing a pattern here on what our survey said, what the global survey said, and here as well in this very most recent survey of US physicians. I found this interesting. Would ophthalmologists take a salary cut to have better work-life balance? More than half said so. But interesting, when asked what measures would help most with burnout, increased compensation was on the top. And there's some thought that when doctors feel like they don't have much control over the factors that bring on burnout, that at the very least, they'd like to get paid more, a feeling that they are valued more. So I think this is part of why increased compensation was higher when asked in this way. When asked if your workplace offered a program to reduce stress or burnout, most didn't know or said no. When asked if they sought professional help, look at these statistics. Only 13% said that they were reaching out for help with their burnout. And I think this reflects the traditional thinking of us as physicians for ourselves that to seek help is a sign of weakness. And so the vast majority of people aren't getting help, and many of us won't even consider getting help even when we thought that we need it. How has burnout had a negative effect on your relationships? Now, I will remind everybody that around the world it is Valentine's Day, but unfortunately, burnout is impacting our family relationships, as well as our romantic relationships. And you can see here some of the quotes on how burnout has affected different people. They're quick to anger, put a strain on my marriage, no time for friends and family. My son hates me for not being around. How do physicians cope? Exercise is number one. Time with family, friends, sleep, spending a little time alone as well. I was interested here that nutritional eating did not make the list, but eating junk food and binge eating did. So I'm looking forward to hearing from perhaps Dr. Saw and Dr. Grossniklaus on how we can be better nutritional eaters. This is a quote from a physician that quit during COVID. She was a physician at a prison on Rikers Island in New York. And she said here, for me, doctoring in a broken place required a sustaining belief that the place would become less broken as a result of my efforts. And I simply could not sustain that belief any longer. We recognize that systems have an impact on burnout. And in the United States, the American Medical Association has described tackling burnout as one of its biggest platforms for 2023. Looking at AMA statistics, we see the increase from 2020 to 2021 in burnout. We see the decrease in people who would recommend being a doctor to their family members or would choose medicine as a career. Look at that decrease from over 70% to just barely 50%. 20% of us are planning to leave within 2 years, and a third of us are planning to cut our work hours. In 2021, over 100,000 physicians in America left the workforce, but less than 40,000 joined. The root causes of burnout, interestingly, how much EHR, the increase in the portal messages, the things, the tasks on top of patient care that we have to take care of. And it's found through AMA statistics that women spend almost an hour and a half or more than almost 2 hours more on EHR tasks and have more childcare duties. We've all heard that if we can be more resilient, we can protect ourselves from burnout. But if you look physically at what the definition of resilience is, it's the ability of an elastic material to bounce back from compressive stress. But the key to being able to bounce back is that compressive stress has to end. And we're all tolling under conditions where the continued stress doesn't end. And that's why resilience is just not enough. This is a quote from the Vice President for Professional Satisfaction of the American Medical Association. And she says, if 1/3 to 1/2 of nurses and physicians cut back or leave, we simply won't have enough healthcare providers to meet the needs of our patients, which is why the AMA has launched their initiative to reduce physician burnout. And they're looking at many different areas that impact us, as we've seen in our surveys. In particular, this year, they're looking at EHR improvements to see if we can be more efficient at the number of clicks that get us from seeing a patient to dispatching a patient. But there are many, many, many areas here that the AMA is looking at. The American Academy of Ophthalmology offers courses at our annual meetings. We also have website resources recognizing the role of the individual in combating burnout, the role of our practices in combating burnout, and the role of COVID-19 measures in combating burnout. This is a most recent email blast that goes out to all Academy members highlighting our priorities for advocacy for 2023 to reduce practice burdens and to call on our congressional leaders to do something finally about physician burnout. So to wrap up, my take-home messages to us all today are: burnout is real, it's affecting us globally, and it's worsening. Moral injury is what happens when we know what we need to do for the best care of our patients, but we are incentivized to do something else by a mismatch in our healthcare system. We know that burnout destroys lives. It impacts us physicians in the way of broken relationships, substance abuse, depression, suicide, but impacting our care on patients, it impacts our patients as well. Decreased patient satisfaction, decreased quality of care, increase in medical errors, decreased productivity, and increased physician turnover. Burnout manifests in us as physicians, but it originates in the systems that we practice. And therefore, the solutions to burnout have to at least begin with our systemic roots. And let's remind ourselves why we chose the profession of ophthalmology. Restoring sight is one of the most rewarding things that we can do. And I think it's important for us to remember that and to grasp that as we lead ourselves on. And I think it's also the role of organizations like Orbis and our supranational societies to help our hospital systems, help our governments understand the impact of physician burnout and work together to make it better. And now I'm going to turn it over to my colleague, Dr. Grossniklaus, who's going to talk about the important role of personal wellness, of sleep, of social networks, of meditation, of nutritious eating, of hobbies, because those things can make a tremendous impact on burnout as well.
Tamara, thank you very much. That was just amazing. You know, I think I definitely could relate to a lot of the things that you have talked about. So our next speaker is Dr. Hans Grossniklaus.
Thank you, Dr. Saw and Dr. Fountain. It's a pleasure to be part of CyberSight today, and greetings to everyone around the world. And I share Dr. Fountain's message about Turkey and Syria, and our thoughts go out to you. So this isn't a book. This is part of journaling, which one might use as a mechanism to deal with stress. So I started journaling a few years ago. And one thing that Dr. Saw didn't mention is I've been a volunteer for NAMI, the National Alliance for Mental Illness, and a leader of family sessions for NAMI. So a number of things I've learned from my volunteering for NAMI, I've been able to apply in my own life regarding handling stress and dealing with burnout. A number of years ago, I was in the Philippines giving a talk, and I was invited to go to the Palawan Islands, and I was there thinking about things, thinking about my life. Questions I had, maybe some of you have had, is what am I doing? Why am I here? Where do I fit in? What's my purpose? And I developed a framework for thinking about this, which Donny has called the life tree. I think that's a good name for it. And I came to the conclusion that there are a number of branches of the tree that can help explain to me why I am here and why I am doing what I'm doing. And I or you would be the trunk of the tree. So this is a metaphor for my life, possibly your life. You're there, I'm where I am because of my parents and background, which are the roots of the tree. There are a number of branches of the tree that lead to where I am today. One is inspiration. That's a big part of my life. What inspires me? What makes me tick? What's my true north? Why am I doing what I'm doing? This could be from patients, from colleagues, from my parents. It's probably going to vary from individual to individual. Another branch of my life tree is balance, and Dr. Fountain alluded to this. This is work-life or work-family balance. And I know there's a part of my life, a big part, that's not ophthalmology, and this is my friends, my family, and I also have volunteered, as I mentioned, I volunteered for NAMI. So I would suspect for all of you, you have more to your life than ophthalmology, and probably some of these things are part of your life that help with the balance between your professional life and personal life. Another thing I thought about was counsel. So if I'm having a problem or a situation that I'm trying to deal with, I use others to listen to my problems. These are people that are very good friends that I trust. I've basically developed a network of friends that I can talk to anytime, any time of day, any day of the week that will give me advice or at least listen to me. And of course, my spouse is probably the most important member of this council. And the council keeps me grounded. It's sort of a reality check. So that's part of my life tree, probably part of your life tree as well. Another part are these so-called guiding lights, or parts of the tree that lead to benchmarking. And this is where I was able to decide where I was at a certain time in my life, and how it sort of compared to other people, such as my mentors, people in organizations, etc. So, it's kind of thinking of my life in such a way that I'm not the first person to go through this. Many have gone through many of the things that I've been dealing with, and probably you've been dealing with, and you can see how others have dealt with this. And finally, one finds their niche. I found my niche, why I am where I am, why I'm doing what I'm doing. Everyone on this conference has their own niche, and you will find your niche at some point. And your niche will be different from everyone else's niche. You are you, no one else is you. You have your own story, and it's unique. So I started thinking about these things and journaling about these things. And then I came to the thoughts about healthy ways to deal with stress and avoid burnout. And for me, things could be quite stressful, as I am, besides a ocular pathologist and ophthalmologist, I take care of ocular oncology patients. So there was a survey a number of years ago, a Gallup survey, asking people, what are the diseases you most fear in your life? And the number one disease was cancer, and the number two disease was blindness. So I'm dealing with patients who have cancer of the eye, which could lead to their death, and they could go blind from the cancer. And my treatments that I use to treat the cancer can cause blindness as well. So these are very stressful for me, trained as an ophthalmologist. I want to save people's vision, but sometimes I have to treat a cancer that will cause a person to lose vision. So it's kind of a paradox for me, which cause stress. Also, I do research, I teach, I do outside things. So there are many things in my life that were stressors. Then I thought about ways to deal with these stressors and avoid burnout. And these come mainly from NAMI, from my volunteering with NAMI, and learning about different ways to deal with stress. And many of you have done these. I think the last patient the last question in Donny's survey asked about these things, and many of you are doing these. You probably just haven't named them the way you do it. The first is diffusion. This has to do with talking to others, diffusing your stress with your colleagues and your spouse or significant other. So there's only a certain amount of stress that you have, and the stress is lessened and distributed among others. I do this every day as a pathologist. A physician will send me a piece of tissue, ask what the diagnosis is and what to do with it. So I'm dealing with that contributor's stress about the pathology of the disease they're dealing with and how to take care of it. We as physicians do it all the time with patients. Patients ask us to help them, and then we essentially take on part of their burden by essentially conveying that we will help with your disease. You don't have the burden of worrying about treating it or getting better. We'll take on that burden with our understanding of the disease. A second mechanism that I've used are baby steps. A number of years ago, I was writing a huge grant, a 1,000-page grant, and I There were multiple parts to the grant, and I thought, looking forward to doing this, I wondered, how am I ever going to do this? It's such a huge task. Well, the way I did it was broke it down into small parts, and I thought, I can't do this big, huge grant, but I could break it into parts, and I can do part A. And once I have part A done, I can do part B. And once I do part B, I can do part C. So many of you have used this mechanism as well for dealing with stress and avoiding burnout. Another mechanism is modeling successes. And I have had questions about this. What does model success mean? Well, you are where you are, and because in part you've dealt with stress in the past, and many times you will be confronted with a problem. It'll be a stressful problem, but if you think back, you've probably dealt with a similar problem as well, and you've come through, and you're still standing, you're still here, you're still breathing. So you've dealt successfully with problems in the past. I've dealt successfully many times with problems in the past that come up again and again, especially in patients who have cancer of the eye. And I just remember how I got through it and what I did to get through that stressful situation. And the last skill is mindfulness. And mindfulness is being in the present. Don't dwell on the past or worry about the future. You can't do anything about the past. The future is yet to come. Don't worry about the possible outcomes. People sometimes jump to the worst possible outcome and are become attached to that and start worrying about that. Well, we don't know what the future holds. So one metaphor I use for this, or a tool I use for this, is thinking about sitting on a hill and watching a train go by, and all you know for real is right in front of you. That's my reality. I'm seeing the car of the train right in front of me. I don't know anything about the engine that's ahead, that's pulling the train. That already happened. I have no idea what's happening to the engine, and I have no idea what's happening with the caboose. That's yet to come. So that's part of mindfulness, and meditation is part of it as well, being in the present. So those are some of the things that I have journaled about and thought about, and developed a way to verbalize skills that help me and hopefully will help you deal with stress and burnout. Now, remember, you're the trunk of the tree. I'm the trunk of my tree, and the trunk comes from my goals and aspirations, inspiration, and asking myself what makes me tick. And this leads to my true north. So the true north is the compass toward your life tree and your niche in the world. And there's a book I would refer you to if you want to read more about it, Bill George's book called Discover Your True North. So with that, I'd like to thank you very much for inviting me to participate in CyberSight. And I also want to say it's all about the journey, your life journey. Thank you very much.
Okay, perfect. Well, thank you very much, Hans. As the audience probably know, Hans is just an incredible individual, and he's extremely insightful and a great person to get feedback. And he's I always enjoy listening to Hans, and so I would like to talk about my story of burnout and hope with everyone. And I actually read many great questions, and we'll address, we're going to actually get together at the end of my talk and respond to some of the concerns and questions that were brought up. And as you know, we only have 1 hour. This is a 1 hour session, and we can't cover all aspects of the burnout, obviously. So we were kind of like going at a high level. And but I am planning on having more sessions in the future to address some of the specifics. But first, let me just say that I'm a pediatric ophthalmologist at the University of California, Irvine. I've been doing what I'm doing now I've been in practice for 22 years. It's just been an amazing journey. But when I first started as a pediatric ophthalmologist, I was just truly excited because this is something that I've always wanted to do all my life. Growing up in a very humble background with a mom and a brother, I was painfully aware of the inequality of access to healthcare. And this is one of the issues that I wanted to address. So I was ready to tackle this problem, and joined various medical organizations. One of them was Orbis. So this was me when I first started. So this is many, many years ago with a lot more hair, darker hair. So I was just very excited. And one thing I liked about this particular organization, Orbis, was that it's a both airplane and hospital-based program. So first, the airplane-based program is that you work inside the airplane. This is where we train the local doctors, and we have the audience, watching the lectures, watching the surgeries, and learning. And a lot of times that is a two-way streak, and where we learn a lot from them as well. And then we have a very advanced technology with the simulation eye models, and we take advantage of these type of webinars. We have augmented and virtual realities. So we train the local doctors to be the best doctors they can be. And then we also have hospital-based program where we actually go to the local hospital and using their own equipment and working with their local doctors and helping them to train. So this was my dream. I had this dream of just making many patients happy and help and giving access to care to those that are in need, and flattening the inequality. But as you all know, and as many of you have served the global health, the reality can be furthest from the truth. First, I started this 22 years ago, and at that time, many of the local hospitals did not have internet. So first, I didn't even know what to pack. And a lot of times that you pack things and you pack as many things as possible, but a lot of it, as a matter of fact, on my first program, about half the stuff that we packed were taken away at the customs. And once you get to the final destination, once you get to the country where you're trying to work, and with all the luggages, and you have to go to the hospital, and sometimes this in itself can be extremely dangerous. And so sometimes you have to go through dangerous roads, and sometimes these roads are flooded. And then once you get there, the first day of clinic is actually not very pleasant, because these patients have been waiting for a long time, and they are waiting for you to help them. And the type of patients that you see can be very challenging. Here's a patient with the brain tumor with a bilateral six-nerve palsy, and that's been going on for a long time. And the muscles were completely contracted in this particular position. And so when I was trying to even do a forced ductions, it just wasn't possible because the muscles were stuck. And then here's another patient with a chronic infection of the cornea, and these conditions are extremely advanced. And then when we get to these hospitals, sometimes the equipment is not adequate, but so we have to set up the equipment that we have brought. And sometimes we just have to tape it to the walls, and so we can identify what we have brought. And then when we start doing surgeries, as you can see here, it's a very basic, and we don't have a lot of things to really help us. What I mean by that is that even the gloves, many of the countries don't have different size gloves, and as you all know, we have many individuals who are joining us today we here in the States and European countries, we have gloves in different sizes, but many countries, many places around the world, they just have one size. So a lot of times I can't even feel my finger as I'm doing surgery, and sometimes many places don't have air conditioning and heaters, and I don't know if you can see in my hand right here that's all sweat. I'm just wearing simply gloves, and I'm just sweating, and I'm just sweating completely soaked. And we had the fan going on while I'm in surgery, in this very delicate surgery. And as you can see, if you don't hold on to the sutures, it will be flown off. And then the equipment that you're exposed to is something that you're not familiar with. So, for example, if you're looking for scalpel, this is what they have. It's a very dull razor blade, and a lot of times that it's been used for so many years. It's just too dull. And then chairs that we have, when we do our surgeries, and this is it. This is what you're sitting on for hours. And then finally, you're just completely exhausted after a long day. And remember, you're jet lagged because you're in a different time zone. And then you're trying to get some sleep, and you have insects crawling on your body everywhere. This is something it's hard for me to really describe how uncomfortable this is, because you can't go to sleep and you just feel very, very uncomfortable. And inside, you just want to cry. You just don't know what to, like, you don't know where to voice your discontentment. But outside, as a leader, you have to show a smile, and you have to act as if you are in control. This is actually not very different than what I do here. So you're working on empty fuel in a place where you don't understand the language, and you cannot read their names, and many times their first and last names. You don't know what they are, and in some countries around the world, they have many duplicates or triplicates of people with the same names, and so you can see how this can be very, very confusing. And this is a setup for a wrong site surgery. And I'm going to tell you, this is, when I went through this early on, and when I went on a medical mission programs, I realized that this is actually not very different than what I go through here in the States in my own practice. I used to think that, gosh, it's going to be so much better here. We have more control. We're going to have, everything's going to be so much more pleasant. But I realized that when I go on these global health programs, my stressors are just condensed down, and that's the only difference. So here in the States, have the similar type of stressors, such as increase in demand, limited resources of time, and lack of control. And we actually, based on survey, that's very important for us. And many of the external forces that you have no control over, support staff, EHR, and all these factors that you have no control over combined result in fear. And that can lead to lack of focus and meaning. So this, fortunately or unfortunately, this happened very early in my career. And I definitely lost my focus and my meaning. And I felt very inadequate and ashamed, because I felt like, you know what, I don't see this in other people. Why am I feeling it? And I knew that the others just weren't voicing it because they were ashamed themselves. It's a sign of a weakness, and that's at least how I was taught. You're tough. You're a surgeon. You're a physician. You can overcome this, and you hear this all the time. You're tough. You can do this. And Hans brought up a lot of great points about the tree. But the thing is that once you have these fears set in, this can impact relationship in every sense, your families, your friends, your mentors. You start retracting and not making those connections. And then over time, you can lose confidence. And as a surgeon, we need certain level of self-esteem. And so with the lack of respect coming from outside, with you feeling inadequate, it's very easy to lose that self-confidence and self-esteem. And that can precipitate into imposter syndromes, and it turns into a vicious cycle. And then when you combine this with in certain situations with the medical legal issues, we talked about the wrong size surgery. And these are like, remember, to err is human. And when we make a mistake, and when our partners and our friends and our patients are focusing just on the mistakes, that can really devastate anyone. And that's what I was feeling during early career of my life. And I was seriously thinking about changing my field, because I was the first physician in my family in history. And I was thinking, maybe this is just not for me. I just went into the wrong field. So I was actually contemplating about changing my profession. It's like, you know what? I'm not good at this. There are other things, there are many other professions out there. That's when I received a letter from someone. It was a letter, and it was something that I think about a lot. And it came from a patient that I took care of years ago during one of the medical mission program. And she was, this letter says, "Doc, are you doing okay? We are praying for you." The thing is that this is a beautiful young lady from an orphanage. I don't know if many of you have been to orphanages. I grew up right next to an orphanage as a child. So this is a place that I fear. I have a fear of orphanages, and I have visited many, and for many different reasons, which I don't want to get into. And this is a child who was from an orphanage who sent me a letter saying, "I am praying for you, and I want to go into a medical field to help people like you." This was I lost words at that time, and many of my friends know that I don't. I rarely am speechless, and this was a time that I was completely speechless. I just didn't know what to say. So, and many of you know this quote. Sometimes our light goes out, and for some, it's often, but it's blown into flame by another human being. And she was that other human being. She was my true north. She was my inspiration. So I'm going to just tell you that all of us will experience storm. And it's even here in Southern California, the weather is not perfect all the time, I guarantee you. And we will all experience various types of storms and challenges. And in situations like that, having a lighthouse, a true north, is extremely critical. And the studies have shown from many sources, and Tamara talked about this earlier, inspired, for those who are inspired, they experience more purpose in life and more gratitude. And I think this is the key. This is a key. It was, being a physician is not an easy task for anyone. And I'm going to tell you, and for those who's in practice right now, I'm going to tell you, is not easy for anyone. And I have talked to many physicians around the world, and they all are looking for places where they can be inspired. They're looking for the lighthouse. And for me, I find this lighthouse. Of course, this child is my lighthouse, but I find lighthouse on a daily basis. They're not that far away. You just have to open your heart. So with that, I would like to thank you. And being an ophthalmologist to me is a true blessing, and because you can help people to see. And I just hope that you can find your true north or the lighthouse and enjoy your career. Thank you. Dr. Tamara mentioned that burnout has roots on the system. What can we do in our institutions to reduce burnout?
Well, I think if we recognize that we all have a common goal of trying to treat the patient, I think if we can start where we can agree on. I think for many institutions, including my own, the friction always lies in the money and how you prioritize patient care. During COVID, it was interesting to look around and see how, not just in healthcare, but see how many people decided that the value and the joy that they got in their job simply was too little to justify the working conditions. And so I think that we as a society, I'm talking about a global society, are starting to recognize how important it is to have happy, well-adjusted workers, whether that's in hospitality, whether that's in education, whether that's in medicine. So hopefully with the recognition, and certainly in the United States, and with my reading, I know it's not just here, but it's getting increasingly difficult to access healthcare. There are fewer physicians. You saw my statistics. We have a net negative for physicians at a time when we need them even more. So I think it's going to start getting everybody's attention when you can't, go out to eat because your local restaurant closed because people don't want to work in restaurants anymore. And I think it's going to get people's attention when they can't get good care or can't get an appointment. So I think our interests should all be aligned in how can we provide patient care, and to work together with the stakeholders, the providers, as well as the administrators on a common goal, and recognizing, at least in America, how critical and central EHR is to our misery. But I think it's something we can definitely tackle. It's just that our incentives have to be aligned to do so.
Thank you. Great. The next question, I think Hans would like to address, is that, isn't it, this is an excellent question. Isn't it awkward to talk to a psychiatrist about burnout, being a doctor yourself? So how do you find a therapist for a doctor? So and in the next question, actually, it's related. Thank you for an important topic, which forces us to face our demons. How can we improve support staff and therefore morale and well-being? We don't seek help or refuse to agree to some suggestions made by management, lest we are classed as weak or not a team player. So seeking for help, Han, I think this is kind of like the theme. What are your thoughts, please?
Yeah, these are great questions. First of all, my first thought is we are all people before we're doctors. We're all humans, and being a physician is part of us, part of me, but it's not all of me. So there are many parts to myself that are not anchored on me being an ophthalmologist, and none of us are just ophthalmologists. That's not our entire identity. So if I go there and just think about my life and other parts of my life, such as work-life balance, it's easier for me to talk to another physician about stress and burnout than if I'm if I put on my doctor hat. So it's basically take off your doctor hat. You're not a doctor when you're talking to a mental health care professional. And it doesn't have to be a psychiatrist. There are lots of counselors and therapists available that are trained in helping people deal with stress, deal with stressful situations at work. How do you find them? Well, in the US, there are resources such as the National Alliance for Mental Illness, NAMI, got a website. You can contact NAMI, find therapists in your area. There's a worldwide one. It looks like it's called United for Global Mental Health. You might find these or mental health support organizations in individual countries as well. But there's a whole world out there outside of ophthalmology, and it may be difficult to admit that that I have a problem or a person has a problem, and one might feel ashamed, but there's no reason to feel ashamed. That's the stigma of mental illness. We need to look at a mental illness, or in depression is part of is a mental illness, and burnout is probably associated with depression. So it's a condition just like anything else, like a eye disease or any other condition. So one thing is dropping the stigma of having to ask for help, and just sort of letting go of things, and realizing there are resources that are readily available.
Mhm.
And
Thank you,
Hans,
Hans.
I think our younger generation is a lot more, they're a lot more accustomed and comfortable with seeking mental health therapy. That's just been my observation with residents and my own adult children. So there's room for optimism here, I think.
I completely agree. My daughter is a physician as well, and I think she would support that as well. So yes, there are things that if you need help, admitting one needs help is not a weakness. It might actually be a strength. So
Yes. Yeah, being vulnerable. Yeah, I think, Hans, that's a great point. Being vulnerable is actually a sign of a strength. And just like Tamara talked about, remember, more than 50% of the physicians are burned out. So this is a major, it's a significant problem that I think we are ignoring. And I think we need to, just like anything, we need to face it head on. And I think we're going to go for 2 more questions and then end it. This one is a question for Tamara. This theme would come up quite a bit. Our world nowadays is full with ungrateful people. No matter how much effort we put to treat our patients, these ungrateful people will always try to find tiny mistakes we did. And then there was another question that was very common, that was great, that was very important. We did not mention the medical legal stress that we doctors go through. You being the very heavily involved with the OMIC, and this is an area that you're very familiar with. So there's a significant stressors that come from these areas, medical legal world, the ungrateful patients. So what are some of the tips that you can share with us, Tamara?
Yeah, that's a whole other hour lecture. We should actually, seriously, dealing with the unhappy patient. So what a great question. I think it's human nature. I think it has something to do with us really not wanting to get eaten by mastodons, that we magnify the negative. And I know it happens in my life. I have, mostly very, very happy, grateful patients. People have given me flowers and written me cards, but I can actually tell you the names of 5 people who have been really unhappy with my care. And I think that's just human nature. When I give talks on medical legal risk and dealing with a lawsuit, which I personally have as well, as much as possible, we have to try to compartmentalize when negative things happen to us. And I think one great quote someone said to me one time is, you know what, in life, the really, really good things, they don't last, but also the really, really bad things, they don't last either. So we just all have to kind of hang in there, push forward, recognize that we aren't the only ones. Think again about the teachers, the school administrators in our children's districts, and the heat and the vitriol that they are taking right now. So it's I think a reflection of the coarsening of society, and we are just part of the population that is on the receiving end of that. But I think one redeeming feature when I think about it is just to maintain perspective. And at the end of the day, we are all physicians taking care of patients. We chose this field for a reason, and we still have the reward and the privilege, the true privilege of laying on of hands, making people better. So on my down days, I try to recapture those moments, and like everything else, the bad stuff, that will go away as well as the good stuff. So I just try to keep one foot in front of the other and one day at a time. And that's my advice for us all.
Yeah,
I'll make a quick comment, Tamara.
Yeah,
What you're saying is I would call you're remembering successes. You're remembering your successes in happy patients, in the privileges of being able to take care of those patients. And we all have successes.
Yeah, thank you, Hans. One last comment I think I'm going to address. So here, it was a nice comment from a physician from Botswana. Hello from Botswana. Burnout is a major concern in my country, with very few ophthalmologists practicing in the country, and this lecture is quite insightful to me. So I'm going to share this with you. There are many countries around the world where there's one ophthalmologist per 1 million population. And I actually have been to these places where I go to their clinic, and these patients have been waiting since 3 o'clock in the morning outside in rain, waiting to see you. And of course, they have certain expectations when they see you, when they see the doctors. But if their expectation does not match what they expect, then there's a huge disappointment from both sides, from both the patients and the doctor's perspective. You know, that's why it's very, very important for us to focus on training young doctors, new doctors, and new generations. And that is something that we really need to focus on. And Tamara talked about how we have more people retiring and then the people coming in. And this is one of the things that I think we do need to focus on. But I do want to thank those individuals around the world who are serving those people in need, you know, with the with source of very little resources. And Orbis, our organization, truly appreciate that, and that's something that I have witnessed myself. And from the bottom of my heart, I thank you for what you do. And I think this is such an important topic that I think we'll have another webinar in the future, focusing on some of the areas that we did not touch on. What are some of the concrete things that you can do to your practice? You know, what are some of the things that we talked about the medical legal aspect, and how do you deal with the ungrateful or unhappy patients? And I think these are very important topics that I think we could probably have a panelist address some of the things that they and share and talk to us about how they address it, because I could guarantee you every ophthalmologist that I know go through these type of stressors. There's no exception. Thank you very much. This is recorded, and please share this video with everyone, all your colleagues, all your friends, and thank you for what you do to help our patients with their vision and sight. Thank you.